Thank you again. Let's go ahead and introduce Dr. Grace Gombolay. Dr. Gombolay is a pediatric neurologist at Children's Healthcare of Atlanta and assistant professor at Emory University School of Medicine. Dr. Gombolay attended medical school at the Johns Hopkins School of Medicine, where she was awarded a year-long position as a Howard Hughes Medical Institute National Institutes of Health Research Scholar in basic immunology research. After finishing medical school, she completed a pediatric neurology residency at Massachusetts General Hospital. She then completed an additional year of fellowship training in pediatric neuroimmunology at Boston Children's Hospital, Brigham and Women's Children's Hospital, and Massachusetts General Hospital. Over the course of her career at Children's, Dr. Gombolay started the Pediatric Neuroimmunology and Multiple Sclerosis Clinic. This multidisciplinary clinic helps manage all aspects of patient care, including medical, psychological, and school-related issues. Her goal is to have the clinic become part of multi-center collaborations for clinical care and research. Dr. Gombolay also serves as a part-time consultant for the Centers for Disease Control and Prevention, the CDC, where she reviews cases related to surveillance of acute flaccid myelitis cases in the US. Dr. Gombolay strives to provide excellent clinical care to patients while studying the mechanisms in the immune system that result in disease and ways to modify disease. Welcome, Dr. Gombolay.
Great. Thank you so much. And thank you for having me. And I'm looking forward to our discussion later on. So first, let's talk about a brief overview of pediatric multiple sclerosis, or MS, as I'm going to refer to it for the rest of this talk. So let's talk about prevalence. And prevalence means the number of people who have a certain disease at that given time. It's not incidence. Incidence is that number of new people who are diagnosed with the disease. So prevalence is who currently have the disease. So the prevalence of MS is that nearly 1 million people live with MS in the US. And then that actually ends up being over 2.8 million people worldwide who live with MS. MS in children, or pediatric MS, can be rare, where about 5% of all persons who live with MS will be in pediatric population. So fewer than 5,000 children and teens live with MS in the US, and this extrapolates to about fewer than 10,000 children and teens live with MS worldwide. And so in terms of MS, there's lots of things around MS. And so let's walk through this figure here, this cartoon that we have here. And as you may know, is that your brain affects your entire body. And so whenever there's injury to different parts of the brain or in the spinal cord, that can lead to different symptoms. And so first, let's talk about the healthy neuron here on the left. A neuron is another name for a brain cell. And all of our brains and spinal cords are made up of neurons, all of these brain cells. And what happens is that you see the cell body, which is the main house of where all the signals occur. And that has to go down this nice long stretch here, this line here, which is surrounded by what's called Schwann cells here in the orange. And what happens is that whenever you're thinking about doing something, for example, here, this person is picking up a coffee cup, there has to be a signal from this blue cell body that goes down to the tip of the neuron or the cell, and the signal goes down across these Schwann cells. What happens is here in this damaged neuron showing here on the right is that for some reason there can be injury that occurs to the neurons. In this case, in MS, is inflammation, or the immune system actually goes and attacks the myelin. The myelin is that covering. And so what happens when you have damaged myelin, you have this exposed nerve fiber, the signal actually travels slower and actually may not be able to travel at all sometimes. And that can result in symptoms such as in this picture of the person actually dropping their cup. And so because of that, we know that there's different areas of the body that can be affected, including the eyes, so such as vision, the spinal cord can be affected, your different senses, so feeling, a lot of patients can get numbness and tingling with it. Muscles can be affected by this. Your brain itself and thinking can be affected. Your mouth and your speech can be affected. It can actually affect because there's lots of nerves that are also connected to your stomach and digestive system, and sometimes that can be affected too, along with what I call peeing and pooping, which makes people laugh when I talk about it in the office, but it's very important, or urination and defecation, where all these bodily functions can also be affected in MS. Next slide, please. And so I liken this where when we talk about this in the clinic, because we have computer cords and wires, is that your nerve is like this wire that goes, from point A to point B. But as you can see here, when you have damaging in the coating is also known as myelin in the brain. When you have damage to that coating, you can imagine you start getting fraying of the wires and you start affecting the connection. And that's where the symptoms can come from. Next slide. Yes, and there's lots of different studies looking into this, but generally what we know is that women are 3 times more likely to have MS than men. And then MS is more common the further away that you get from the equator. And so, as you know, the equator is the center line around the Earth. That's where generally you have technically more sunlight and that sort of thing. And so, as you're getting more away from the equator in the more colder areas with less sun, that's when people are more likely to develop MS. And so who gets MS? And so there's lots of different reasons why people can get MS, and it starts with genetics. So genes are the blueprint instructions that make up your body. And this is the thing that I talk, it's kind of like an instruction manual, a book. And it can develop things like the color of your hair, your skin, your eyes, how tall you are, and different things like that. Genes can increase the chances of getting MS, but it's not the only reason why people MS. And so, for example, only 1.5%, which is 1 in 67 people, will have a chance of getting MS if either their mother or father has it, or which is a first-degree relative. And what I think is also interesting is that, let's say you have, especially a twin, is that 1 in 37 of twins, so 2.7%, they will have a chance of getting MS if their twin has it. And twins have the same genes. So you think that if it was purely genetic, if one twin has it, that the other twin was definitely going to get it, but that is not the case. And so there's lots of different things where the genes are one aspect of why someone gets MS, but it's not the whole reason. Next. And then one thing to know is that there's nothing that anyone does. So there's nothing that a person living with MS did. There's nothing that their family or their parents or their loved ones did that caused you to get MS. So I wanted to make that clear. And something else to know about MS is that, especially with all the treatments and other supports that we have available, people now who live with MS can actually live a relatively, long and happy life. I tell everyone, especially, because I see mainly children, I say you can go to school, you can go to college if you want to, you can get a job, you can think about getting married and having children. You can do all of those things. And so it's one of those things that you have to think about having MS. It's always going to be something in the background. You have to, be mindful of your treatments and if you start having symptoms. But generally, our goal is for everyone to live life that they want to. Next slide. So there's just different types of MS and then relapses. So we'll go through some of these. And so types of MS include clinically isolated syndrome, which is where a person first comes in, they have some neurological symptom that we know is related to the immune system attacking either the brain or spinal cord, and we think that they're high risk for having future attacks. And so that's clinically isolated syndrome. Most patients who have MS, especially in children, are going to have what's called a relapsing remitting MS. Relapsing remitting means that you have a relapse, which is where you have an attack, but then you get better, and that's where the remitting phase has it. And so most people, especially early on, will have an attack or relapse, and then that will get better. As time goes on, and this is what we're trying to prevent, especially with all of the treatments that we have, at some point in time for patients who are living with MS over time, they start off at the relapsing remitting phase. And at some point in time, they will slowly grow on to have new symptoms all of the time without any clear attacks. And that is when they've sort of moved from this relapsing remitting to secondary progressive phase. And fortunately, we are delaying that more and more and hopefully preventing it more and more because of the treatments we have available. But just so that you're aware, that can occur. And then finally, there's the primary progressive type of MS where somebody never had a clear type of relapse where they've in that relapse remitting phase. But when they first present and they start having these gradual worsening of symptoms, people look at the MRI, the doctors look at the MRI, they look at everything else happening, and then they realize that they actually have MS and it's part of this progressive phase. There's some debates on whether primary progressive and secondary progressive are the same thing or different. For intents and purposes for this discussion, that's kind of how they're defined. And then relapses is sort of where you have this attack where someone feels worse for more than a day. And usually those attacks can occur more than 24 hours if it's related to MS. And then again, these are no one's fault. It's not something that someone did or that triggered it. They just can occur sometimes. And that's the goal of treatment, is to prevent that from happening. So let's talk about some common body changes because of MS. And we, of course, sort of talked about this before, but I just really wanted to highlight these are some of the common things that a lot of patients report to me that we're trying to help with. So number one, they feel very tired. They feel very fatigued. That happens quite frequently. They feel like their body feels weak. And that can actually be where an arm or a leg or a hand doesn't work the way that they want it to, but sometimes they can just feel their whole body just feels weak all over. A lot of persons living with MS can feel anxious or sad, and that has been shown where persons with MS are twice as likely to develop where there's anxiety or depression. We're going to talk about some of these things. And I feel like some of these things may seem like repetition, but I just want to reiterate, these are very common things that persons living with MS experience. And another thing that a lot of people will report is they'll have trouble focusing. The term that they might use is something like brain fog. And these are very, very common, and it's related to the inflammation that we see in MS. Next slide, please. Managing MS with medicine. And it's one of those things where this is a discussion with your healthcare team of where I want to empower the persons living with MS to help make the decisions. Obviously, the caregivers, the parents, the loved ones also are putting their input. But it's one of those things where we have this discussion when we decide what medicine to use. And obviously, there was a previous session that talked about medicines, but so we're not going to go too much in detail on this talk. But it's one of those things where you have a discussion with your healthcare team of what you think is the right medicine for you. And one thing that's important is that to help prevent or the relapses from happening, to help with some of the symptoms that we're going to talk about, taking medicine regularly will help with your health. And it's one of those things is that as children and people grow and over time, is that those treatments may change, but that is okay. And that is quite common that can happen in MS. So let's talk about symptom management and when to call your doctor. And these are some broad guidelines, but generally I want to say, if you're concerned at all about something, always feel free to call, to reach out, to talk to someone to discuss, if this is what's happening. But these are some general guidelines that I recommend. So number one is, how do I know if I'm having a flare or a relapse? Because that's one of the things that that people can be worried about having. And so, how do you know? And so a flare or relapse, like we talked about earlier, is sort of related to an MS attack, and it's new symptoms or worsening symptoms that last longer than 24 hours. This is a time where you definitely need to call your doctor at that time if you think you're having a relapse, because you want to talk to your physician and say, okay, what's happening? What's going on? And if it is a relapse, and taking the measures immediately to take care of the relapse. And so it can be helpful, even if you don't think you're having a relapse, it's just tracking and reporting symptoms in general. And this is really helpful just because even though a lot of things are related to MS, we can think about through the symptoms and say, okay, what is happening? What symptoms are you having? And how do we help those symptoms? Because even though you're on a good medicine to treat the MS, we want to make sure that that the person's living with MS feel good, that they feel well. And so it helps to look at these patterns. So different symptoms that a lot of persons with MS will report, such as the headaches, the fatigue, the numbness, tingling, and the weakness, and then identifying potential triggers outside of just the MS. So for example, especially with headaches, headaches are very, very common in people, even those who don't live with MS, and there may be certain triggers that have it. So we know that poor sleep can be part of it. If you're dehydrated, you haven't drank enough fluids. Some people, I have a friend who gets really bad migraines, and for her, if she eats strawberries, she knows that's her trigger. And so then she doesn't eat strawberries because she doesn't want to trigger headaches. And so if you sort of look at patterns, you can say, oh, this is what I was doing, this is what was happening, and then this happened. And then when you start seeing those patterns, you can say, hey, maybe that's a trigger for some of these things. It's helpful to write down how long it lasts, for whether it's minutes to hours to days. Again, if it's certain symptoms that's lasting for more than 24 hours that you're concerned about a relapse, you need to call immediately. So don't do that. Don't wait to the next visit to tell your physician. But it's important to know that if it's a symptom that comes and goes, or if it's constant. So for example, I've definitely had a patient who came and reported, oh, I have some numbness and tingling that happens. And of course, whenever I hear that, I need to make sure that this is not a relapse. But it was just for a few seconds. When they first got up in the morning, it would happen for a few seconds and it would go away. And it would happen the next day again for a few seconds and then go away. And so that is less likely to be an MS attack. And so that was more related to what's called Lermite sign, where if you move your neck because you have a lesion or an area of damage in your cervical spine, which is in the neck, then we realized that when the patient moves their head around, that's why it was happening. So it was related to an old injury, not a new one. And so just knowing the pattern of if it's constant, if it comes and goes is important. You can write it down on paper if you'd like. And then for those of you who have a smartphone, I personally find it's easiest just to type it in a little notes thing in your smartphone because I'm someone who sometimes loses paper, which a lot of us do. And so if you have it in one central place that you know it's going to be, that will be a good place to put it in. Next slide, please. So what about a pseudo flare or pseudo relapse? So this can also sometimes be confusing because there can be symptoms that resemble a relapse or an attack, but it's not actually a true attack. And this is what happens. So the only way that you know this is a pseudo flare, pseudo relapse is, number one, it has to be symptoms that are similar to the symptoms you have had in the past related to an MS attack. So for example, for optic neuritis or inflammation in the nerve in the eye is a very common presenting or common attack feature in MS. And so if I have a patient who had a history, meaning in the past they had optic neuritis in the left eye, but then they call me and they say, oh, I'm now having similar symptoms that I had in the left eye in the past, but now it's in the right eye. So it is different because it's a different location. That is something where I'm going to be worried about that it's a new symptom, that's a new attack. Whereas if they call me and said, oh, I had a history in the past, I had this attack in the left eye, and now I'm having the symptoms come back again, then that could be a pseudo relapse. And here's some of the other questions and features that make me know this is a pseudo relapse or a pseudo flare. Number one, it occurs during heat or illness, and that can be different things. It can be when people are exercising, so they get hot. If they're outside and it's a hot day. I had a patient who every time they were in the hot tub for longer than 30 minutes, they would feel like some of their old symptoms would come back. And when they got out of the hot tub, it would go away. So I told them, you can go in the hot tub, but go for 25 minutes, not 30 minutes. So you're not getting this pseudo flare phenomenon. It's safe, but I just don't want them to feel the symptoms that they have related to their MS. And then the other time that it can occur is also if you get sick. And that's with any sort of colds, fevers, that sort of thing can also trigger the pseudo flare. If it occurs when you're hot, then you have to cool down, and that can be different ways, whether it's drinking some ice water, if you're outside, getting into where there's air conditioning. Cooling fans are really helpful. They make this really fashionable cooling scarves or cooling vests that you can wear. That people can wear to help with that. And then if it's during illness, then, treating the illness, especially treating the fever, can be helpful. But if they don't go away after a few hours, usually my cutoff is 4 hours because it should go away within 4 hours. If they don't go away more, it's lasting longer than 4 hours, or if you're concerned about them at all, you definitely need to call your physician when this happens. So this is where we talked about when you're sick and you have a fever to take Tylenol or Motrin or ibuprofen to help the fever. And if you do have a fever, especially if you're on a medicine for the MS, because as you know, the treatments for MS can lower your immune system just a little bit and make you more prone to infections. Please let your regular doctor know. Usually it's your primary care or your pediatrician, because they can check you out for an infection. So for example, bladder infections such as a urinary tract infection or UTIs are quite common in people even without MS. And so you're more susceptible to that if you're on an immune medicine, or if you have a cough, and making sure that your doctor checks you out for a pneumonia. And then if you test for positive for COVID, also let your doctor know. Fortunately, COVID's a little bit milder in children than in adults, but we know persons living with MS have a slightly increased risk for more severe consequences related to COVID, and there may be COVID-related treatment options depending on the time of the year and what's happening with guidelines. And so just let your doctor know in case that's an option for you if you have COVID, and these infections may need treatment. And again, if they do go away within a few hours, and this is not a relapse, but if they don't go away, please call your neurologist, your neurology care team who's treating your MS so they are aware, because this might actually be a true relapse. So, what are some lifestyle habits that can help with MS? And so, these are different things that are just helpful for life and good healthy habits in general. So, number one, sleep. Having good sleep, and I can't tell you how many times and how much time we're talking about sleep in the clinic. And it's one of those things, right? We all have smartphones. We're all on our smartphones late at night, especially a lot of our the children and teenagers, right? They're talking to their friends, and then you have to keep up with everyone because of social media and all of those things. And all of those things, that light from the smartphone interferes with sleep. And so really developing good sleep habits can help with just with energy and fatigue and all of those things, which we'll talk about. And we will reiterate some of these things in the next slides, showing you how important that is. A healthy diet can also be helpful, which we'll talk about in a few slides. Also, vitamin D. And so we often check for vitamin D levels if you have MS, and then we'll put you on a vitamin D supplement if needed, just to make sure, because there's some studies showing that good vitamin D levels prevent attacks in MS. Stress management, really, really key. It's hard to know if a stress can cause or trigger relapses, but I've had so many patients tell me that, when they were increased stress, that it potentially could have been related to their relapse. So, and it's just helpful in general for just, the other symptoms that can occur in MS. Um, I would generally avoid other drugs, other medications, whether it's recreational drugs or other things that have not been discussed or prescribed by your doctor. It's one of those things, if you have questions about something, this includes supplements, I would discuss with your doctor before starting them. And the reason for supplements is that the supplements are actually not technically regulated by the FDA, the Food and Drug Administration. And even though most companies are pretty good about really just listing all their ingredients in there because they're supposed to, once in a while, you don't know what you're taking. And so if you're thinking about a supplement and that sort of thing, make sure you discuss it with your doctor before starting. And then avoiding smoking and vaping. There's studies showing that people who smoke are more likely to have worse outcomes or more issues related to their MS. And then smoking can cause other health issues, including affecting your blood pressure and affecting your heart. So as much as possible, avoiding that can be help with your health. Next slide, please. So let's talk about diet, exercise, and healthy behaviors. And then if you get a chance, there's some links on the National MS Society. Here's one here. But if you go to the National MS Society, they have a lot of different wonderful resources and web pages for you to look at this. So diet and nutrition. And thank you, Krista, for putting that in the chat. So healthy body weight is associated with decreased risk for MS-related disability and disease activity, like relapses and new MRI lesions. And diet has a strong relationship to body weight and development of other risk factors, like we talked about, cardiovascular, so affecting the heart or the blood vessels, which actually relates to blood pressure, high blood pressure, and then high cholesterol and diabetes. And there's other studies looking at how diet affects the gut microbiome. So the gut microbiome is the bacteria that live in the gut. And there's a lot of this interaction of the gut microbiome with the immune system in your body. About 50% of your immune cells actually live around the gut. And so there's something about this interaction of the bacteria that live in the gut and then the immune system that may be affected in MS. And so if you have, so for persons with who have a healthy diet, generally have a more healthier gut microbiome and have less inflammation. And so there's other benefits of having a healthy diet. So dietary metabolites, and this includes vitamins, fatty acids, and amino acids, which are the building blocks that form proteins. They can also have direct effects on the immune system and the brain. And so having a healthy diet can help with just health in general, but also potentially help with preventing inflammation or attacks in MS. Next slide, please. So in terms of healthy eating, and I get this question quite a lot. So what does that mean, healthy eating? Generally, there's technically no best diet for people living with MS, but there's some general guidelines that can be helpful. So number one is preparing meals at home as much as possible. We all like eating out, and I think once in a while is also, totally fine. But when you're not preparing the food yourself, you don't know what's going in there, and that includes how much salt and sugar and other oils and other things. Incorporating colorful fresh fruits and vegetables daily can help. Well, more higher fiber can help with preventing attacks in MS. Choosing whole grains over refined grains, and then avoiding and limiting processed foods and added sugars as much as possible. And then there's some work looking at maybe that healthy fats, such as nuts and olive oil, may have some anti-inflammatory effects. So eating some nuts or olive oil can be helpful too. Next slide, please. So let's talk about weakness. So if you feel like there is muscle weakness happening, there's lots of different ways to help with that. Exercises, including physical therapy and occupational therapy, can help because they're helping you strengthen the muscles. The other thing that this helps is that exercise can actually not only help the muscles directly themselves, but it actually strengthens the connections between the nerves and the muscles and potentially helps with repair. So there's a lot of studies now looking at exercise, how it sort of helps increase growth factors, which helps with repair. It may not regrow nerves per se, be able to regrow what's been lost in terms of injury, but at least some growth factors that help strengthen that connection between the nerves and muscles so they work better. The differences between physical therapists and occupational therapists is that physical therapists usually help with larger muscles. They're usually helping with things like balance and walking, whereas occupational therapists are helping with fine motor skills. So things that you use your hands and fingers for, and sort of what we call daily activities or activities daily living, things that people do every day, such as putting on a shirt, doing buttons, zippers, tying shoes, writing, so things like that. That's tended to be more in the occupational therapist realm. Let's talk about mental health and mood symptoms. And I alluded to this earlier and just reiterating here again, because this is a really important topic, to the point where I actually have a psychologist, a therapist who is in the clinic with me, who evaluates the patients with me, because this is such an important part of not only mental health, but brain health is what I call it, and also body health. So what we know is that people living with MS are twice as likely to develop an anxiety and depression. And unfortunately, anxiety and depression has just increased overall in everyone, even those who don't have MS, just due to the pandemic. And there's lots of factors contributing to this. And I think this is multiple reasons why this is the case. Number one is that when a person gets that diagnosis of MS, they realize they're living with this disease and it's a chronic disease. This is something that hopefully soon we'll figure out a cure to make it go away. But at this point in time, maybe something that a person lives with for the rest of their life. It's a life-changing diagnosis. It's a family-changing diagnosis. It's not just affecting the person, right? It's affecting the family and their loved ones. And so it's one of those things that's going to affect your mood. It's going to affect your mental health. And on top of that, we know that there's neuroinflammation. We know that the immune system is, attacking the brain and the spinal cord. So we know there's just inflammation in the brain. And so because your mood and mental health also lives in the brain, we think it's a combination of the inflammation in the brain and just living with a chronic disease is why you're more likely to have mood symptoms. And so how can you help with this? And so this might sound familiar, but then lifestyle changes. So good sleep, Diet, exercise, or stress reduction can be helpful. Seeing a therapist or a counselor. Sometimes some people will need to see a psychiatrist and will need medicine to help with that. And what I think about this is that I feel like there's an arbitrary divide for what's considered reasons why you go see a psychiatrist versus why you see a neurologist, because it's all in the brain. And then the medicines that psychiatrists are more likely to prescribe, whether it's related to anxiety or depression related medicines, all we're doing is sort of is balancing out the chemicals, the neurotransmitters in the brain, right? So what happens right in MS is that you have injury to parts of the brain. And so the chemicals in the brain are also going to be off. And so what we're trying to do with these psychiatric related medicines is to help balance all of those things. And so again, I think this is arbitrary divide between psychiatry and neurology because it's all in the brain. Seeing a psychiatrist can be helpful, and being on a medicine to help balance all of those chemicals can be helpful. And then support groups and peer connection, which is one of the things that there's a lot of avenues for this. Social media is great. The National MS Society, all of you being here in person, and those who end up watching this later on online. There's lots of avenues within the National MS Society, and that's one of their many strengths that they do really, really well, is providing those support groups. And we'll talk about those resources later on. And it's one of those things where MS can change your feelings, right? It can affect your mood. These feelings can change day to day. It doesn't matter if you have MS or not, things are going to change day by day. But it's one of those things where if you have these feelings, just know that it's okay. It's okay to feel these feelings. It's okay to have a lot of feelings. It's okay to feel bad. It's okay to feel sad. But one of those things is that, once you have those feelings, when you're feeling sad or bad or worried or anything, what are the ways that we can find to deal with and to fix them and to manage those feelings? And that's what's really important. So let's talk about fatigue. So fatigue can be really hard for people to describe, to really discuss sometimes, because it can sometimes seem very vague, but fatigue is a very, very common symptom in people with MS. So fatigue is feeling a lack of energy, and it can be challenging sometimes to treat in MS. We can provide some medicines to help with fatigue, but we have a limited number of medications. And so, one of the ways that I think is really helpful to think about fatigue is what's called the spoon theory. So, each day, it doesn't matter if you have MS or not, each day a person has a specific number of spoons to get through the day. And so, each spoon represents the amount of energy it takes to complete your tasks, your everyday tasks. So, let's say, for example, someone has 10 spoons for the day. Things like taking a shower or eating, each of them may take 1 spoon each, but something that requires more energy, such as going outside for a walk, may take 3 spoons. And the more activity someone does, the more spoons it will take. And so each day, someone's going to make up with a different number of spoons. And that can be influenced by different things like poor sleep or pain. So let's say that generally someone has 10 spoons, but if they have poor sleep or poor pain or with pain, they may have fewer spoons for the day. So instead of having 10 spoons, they may have 7 spoons instead. And it's hard to increase the spoons for the day. So then you have to think about, the person has to think about how to use the spoons that they do have. And this might end up doing less or resting more. And so it's one of those things where we have a limited amount of energy or spoons. This is true for everyone. So how do we increase the spoons you have for the day? And that's where all those techniques can be helpful, including sleep, managing symptoms. But sometimes people are going to have to be like, oh, I might have to do less today because I have fewer spoons. Next slide, please. So some tips to manage the fatigue. So simplifying tasks to conserve energy. I know this sounds counterintuitive, but developing a regular exercise program. And when you hear this, you're going to say, well, you just told me that fatigue means energy and exercise takes up a lot of energy. And we just talked about these spoons and all that stuff. Studies have shown actually having a regular exercise program actually increases the amount of energy and can help with fatigue. And so it's one of those things where you just start small, like someone just starts small. And this is true for any exercise program, regardless if you have MS or not. You start small and you gradually increase whether it's the how rigorous the activity is or the amount of time. And just doing it regularly and doing what you can be helpful over time. And it's one of those things where if one day you have fewer spoons, you have less energy to say, okay, today I'm going to take a break, and just being okay with all of that. Regulating sleep habits. So that will be things like going to bed at a certain time every night, consistently every night, and then waking up at a consistent time every morning. This includes weekends, which I know can be really hard, especially when lots of activities are happening late in the weekends and when there's not things like work or school where you have the time where you have to get up. But having regular sleep time of when you go to sleep and wake up can actually help with sleep overall, falling asleep better, because your body works on what's called a circadian rhythm. There's a certain clock your body works on. And so your brain likes to have that time of, oh, it knows when it's going to go to sleep, when it's going to wake up. The other thing is about, we talked about smartphones and how electronics and things that light makes your brain to wake up. And so what I generally recommend is turning everything off 1 hour before bedtime to give your time, your body and your brain time to sort of relax and rest. And so they're not getting that light feedback. I will say people are not thrilled when I say this, but the American Academy of Pediatrics recommends turning everything off 2 hours before bedtime. So I'm actually giving you an extra hour. So think about that. Avoid overheating if you can, because that can also drain energy and make people feel more tired. And we talked about some of those strategies earlier about how to help with overheating. Learning energy saving ways of walking can be helpful. And then managing stress. Stress just makes everyone feel more tired. It uses more energy when you have stress. And so all of those things can help with fatigue. Okay. I'm going to stop there. And I think Krista's going to talk about some of the resources that the society has. And obviously, there's some links in the chat here that can help, but there's many, many resources on the website.
Yes, thanks so much, Dr. Gombolay. I really appreciated all the information you gave about the various symptoms, but also the practical guidance that you gave to help address some of those things. So let's talk a little bit more about information and resources that are available to you to address pediatric MS as a whole, but also to address some of those topics that Dr. Gombolay just discussed. First, I would definitely encourage you to check out the pediatric page on our website. All of the things that I'm going to be discussing now are linked there, so you can access them easily at this place, and it is updated on a regular basis. So do please plan to go back and check in from time to time to see what's new and different there. We do have our pediatric MS resource guide that is posted on the page. I often recommend that to families as kind of the first stop as they're navigating a diagnosis. So it's got great resources from other organizations, from us, all specific to pediatric MS. It's also broken down by resources for parents and caregivers, as well as resources for youth and teens themselves. There's also financial resources for families impacted by pediatric MS that are listed on that page. We have a really great financial education assistance program that's available to you there that's completely free and has some really great services available to you. So check that out. And then if you're looking for additional connection opportunities, we'll talk a little bit more about some of those, but I would encourage you to consider Walk MS and other activities in your local communities. I often describe walk events as a family reunion. It seems like everybody knows each other there and are always so excited to gather each year and to connect there. So check those out if those are of interest to you. I also want to highlight our MS Navigator program. This is available to anyone nationwide. It's support through one-to-one customized to each individual. MS Navigators are skilled, they're kind professionals who are supportive people that can help you work through the challenges and changes with MS based on your personal experiences. So they might be able to provide emotional support resources, access and referrals to MS healthcare specialists, support working through health insurance options, benefits, employment resources, talking with you about accessible and affordable housing, wellness strategies, case management, and more. They really can help you figure out what you need and how to talk to the right people to get it. So you can talk to an MS navigator over email, by direct message on our website, or you can call the 1-800 number that's listed on our screen. They can help both parents and kids and give you helpful resources for an entire family. So again, reach out if that's something that's of interest to you. Of course, I'm always here as a resource to you as well. I do also want to highlight some of those peer connection opportunities. Would love for you to check out these groups if that's of interest to you. Our MS Youngsters group is a virtual group that is geared towards high school and college aged young people who are living with MS. They also have an Instagram account. So if your child or if you are not yet ready to join an actual group, you can check out their Instagram page to learn more about what they're doing. We also have a parents of children and young adults living with MS group that meets each month. This is, again, a virtual nationwide group that you are most welcome to join. The same group leader manages both groups, so she has a really great perspective on both the experience of a kid living with MS as well as a parent or a legal guardian living with MS, and she's incredibly supportive, as are all the folks who attend. So please be sure to check those out if they are of interest.